chiropractic care or massage therapy, I think, for certain things where it's just the sore muscles because you went out and overdid it, massage is a great option. But massage isn't going to fix your rotator cuff tear. Chiropractic care, if they do more organized physical therapy and not just joint manipulation, which I've seen both sides of that, it may have a role, but I think that role is probably limited more so in the shoulder than, say, in your back or your neck. That's the beauty of the shoulder, is there's a lot of things that can be managed non-operatively. I would say, and a conservative say that, I probably only operate on 20% of the shoulders that I see. And that's because the vast majority of stuff can be managed non-operatively. That gets a little bit diluted whenever people show up and they already have a rotator cuff tear or they already have surgical pathology. But of new patients that have gone through non-operative treatment that, just haven't quite figured it out, then, a lot of stuff can be managed without surgery for sure. If you've gone through physical therapy with your primary care physician and things have not improved, maybe they've already tried an injection and things haven't improved. Certainly at that point, it's very reasonable to see an orthopedic surgeon and have them evaluate your shoulder. In the setting of a trauma, it's even more important to maybe even bypass the primary care physicians and come directly to see your orthopedic surgeon, just because there are subtle things that are treated differently. So a shoulder dislocation in a 25-year-old, if that's the first time they dislocated, then therapy is probably the best solution. If we do therapy on that 75-year-old that dislocated their shoulder and tore the rotator cuff and they do 3 months of therapy, then I'm not going to be able to fix the rotator cuff. And so the trauma side of things is a little bit more straightforward. But in general, what I would say is if you've tried the conservative measures, anti-inflammatories, ice, rest, physical therapy, plus or minus an injection, and it's still no better, then at that point, it's certainly reasonable to seek out treatment by an orthopedic surgeon.